So a lot of patients, when they first get diagnosed and through the course of their disease, will ask me about the role of physiotherapy and the role of speech therapy. And there are other things that one could think about in that sort of, if you like, non-pharmacological treatment arm. Cognitive training, using online brain training programs such as lumosity.com or Brain HQ, where you can challenge the brain and work it. And I think that's a very reasonable thing for our patients to be thinking of doing early in the course of their disease. Physiotherapy is a bit more obvious, and patients will know that their movements are going to be slower and their balance will get affected, and as such the role of physiotherapy is critical. There is no doubt that getting physiotherapy early in the course of your disease is a good thing, combined with exercise, and there are slightly different things. Certainly we know that physiotherapy can give you things like strengthening exercises, balance exercises, stretching exercises so that your body feels more free, and I think those things are very, very important. Exercise is a little bit different, and you'll see other clips on my website about exercise. And really what we're talking about here is, if you like, getting the heart racing, getting, if you like, a level of metabolism going that can actually help, if you like, to reduce the symptoms of Parkinson's by improving your overall fitness. The data isn't really back on those studies at a level yet where we can say how much exercise you need to do, but it certainly seems to be quite intense amounts of exercise quite regularly. The simplest way that I think I've heard physiotherapists describe it to me is when they say to me, when I ask them the question, how much exercise should I say to my patients you should do? And I think the good rule of thumb is to say you need to be exercising at a level where you cannot hold a conversation for about 30 minutes, 3 times a week. And I think that's a good rule of thumb because there are obviously much younger patients with Parkinson's disease whose intensity levels could be much higher, and then of course much older patients with Parkinson's disease. But all of those patients along the spectrum will know how much exercise it takes to get them to a point where they couldn't hold a conversation because they're so breathless. And I think if you think about the amount of exercise that you may be taking on at the moment, you may realize that you have to step up a little bit more. So physiotherapy very early in the piece, exercise absolutely early, brain training very early, and then speech therapy. Patients will say to me, well, why do I need speech therapy? Well, speech therapy is a bit of a misnomer here. Basically, speech therapy not only covers your speech, but also your swallowing. And those are problems that we see increasingly as the disease progresses. So what we ask people to do is to see a speech therapist early to get a program of exercises, because in actual fact, exercising the muscles that help with speech are also exercising the muscles that deal with swallowing. So in actual fact, having a program of speech therapy early is important because you strengthen those muscles and, if you like, can stave off some of the later problems and hopefully reduce the impact of those. So I think it's fair to say across all of these non-pharmacological approaches, physiotherapy, exercise therapy, speech therapy, brain training, you should be embarking on these as soon as you're getting diagnosed and doing them really at a level that you can really challenge yourselves but not exhaust yourselves, and also is sustainable.